11th Congress da Associação de Psiquiatria do Rio Grande do Sul, em Gramado. DrJesse Wright, I would like you to introduce yourself.
Yes, I'm DrJesse Wright. I'm a psychiatrist from the University of Louisville in Pennsylvania, and a person that's been interested in cognitive behavior therapy for a number of years. I started my work in about 1980 with Dr. Aaron Beck, and I've continued it to the present day in 2013. So I guess we're talking about 30 or plus years of work on being a cognitive therapy clinician, researcher, and lecturer. So,
okay. Thank you. I would like to know, we would like to know, right now, what do you think or what do you feel is your main area of interest, or in your field or in your practice?
My main area of interest is in trying to help more people get access to cognitive behavior therapy. Because if we look at the research data, it's an effective treatment. It's being trained, more people are being trained in how to do CBT, but still they're not even close to being enough therapists and enough resources to treat all the people in need around the world. So what can we do about this? If we still try to use cognitive behavior therapy in the traditional 50-minute session, the classic treatment hour, there are never going to be enough therapists to do the job that needs to be done. So I've been working with other CBT therapists and experts in technology to try to bring technology into the delivery of therapy, which is a relatively new idea, but we think that with computers and other technological aids that we can enhance the work of the therapist so therapists can get more benefit out of the time they have to spend with patients, either in traditional therapy and adding computer tools to that, or in a reduced type of therapy where the patient is not seen for such long sessions or as many sessions, but has the ability to learn the CBT skills and to rehearse them on computer programs and other things that may be developed in the future that use technology as a partner with the work of the clinician.
Are you doing this with supervision too? Working that kind of technology?
I'm using video a great deal with supervision. Of course, that's been done for some time, to record the work of the trainee and to review that, to give feedback. But there are programs that are starting to become available that are on the internet that can help people that want to learn about CBT. There's a system in the United Kingdom called Praxis, Praxis, which is being used to train therapists there. It's a very nice program, and I believe that there will be additional programs that will become available if we project this out into the future some. That I suspect there'll be a day when cognitive behavior therapy trainees will have technology as a significant part of their training program.
And thinking 10 years from now, what was the scenario that you would like to see?
Well, I mean, I've mentioned that I'd like to see technology be embraced by clinicians, that they can find a way that it can be used to actually enhance treatment. But I think that we're likely to see more of a merging of cognitive behavior therapy with some of the other major disciplines. For example, interpersonal therapy. I think it's already happening to some extent. They were thinking about ways that we can blend together some of these effective techniques. We look at the work of Ellen Frank on social rhythms and interpersonal therapy that can be brought into CBT. One of my deep loves for a long time has been the interface between psychotherapy and biological psychiatry, and I see this as a very fertile area for continued collaboration and research. We're starting to see studies of imaging and treatment with CBT or treatment with medication, and understanding how those two different kinds of treatments may work together to enhance the overall outcome. I see this as having considerable potential as we look into the future. But I suspect 10 years from now we'll still have lots of people that are trying to learn how to do CBT, and we'll be doing it in clinics all over the world. I think that there'll probably be places where it's not done so much now, it'll be done more. Brazil is, has strong CBT activity. In China, there's a building interest in CBT. There are places that are hotbeds of CBT right now, like the United Kingdom and the United States to some extent, but I predict that we'll see more countries have more people that are being trained in this and using it, because it's a common sense, pragmatic treatment that you can learn fairly quickly and can be delivered in ways that really help people. Just one more thing that might happen is that there have been some experiments in trying to train therapists who have less education. For example, have not been trained as a psychiatrist or a PhD level psychologist to more quickly pick up CBT skills and use them. And I think there's some promise there that we may be able to increase the legion of people that can do this treatment by spreading it to some other disciplines. For example, nursing, psychologists that have less education, and social work, and even there's some work on peer support. That means patients that themselves have experienced depression and now learn about this and can assist in some way. This is being done in the United States in community mental health centers, where patients, for example, with schizophrenia are hired to come on the staff and work with the clients that are more acutely ill, and they may learn some CBT techniques that they can coach other patients on being able to utilize. So I see it as spreading throughout the international community and spreading among the multidisciplinary facilities that we have, and possibly having technology be a bigger part of the action of what CBT is in our daily practice.
Thank you very much for your time and
Certainly, it's wonderful talking to you.
Thank you.